एवरीवन, वेलकम बैक टू माय यूट्यूब चैनल। तो आज मैं एक टॉपिक पढ़ाऊंगी जो कि है लेबर, जो कि यूनिवर्सिटी एग्ज़ाम के पर्सपेक्टिव में भी बहुत इम्पॉर्टेंट है, साथ ही साथ आपका जो कॉम्पिटिटिव एग्ज़ाम होता है उसके पर्सपेक्टिव में भी बहुत इम्पॉर्टेंट है। तो लेट्स स्टार्ट द सेशन गाइज। आई होप यू विल लाइक द वीडियो। इफ़ यू लाइक द वीडियो काइंडली शेयर इट टू योर फ्रेंड्स। ओके, क्योंकि लेबर एक ऐसा टॉपिक है जो कि पढ़ने में भी बहुत इंटरेस्टिंग है, साथ ही साथ इसको अगर कोई समझ जाए तो इट कैन बी रिटेन इन द मेमोरी फॉर लॉन्गर पीरियड ऑफ टाइम एंड इट इज़ वेरी इंपॉर्टेंट टू कीप इट इन योर माइंड बिकॉज ये लॉन्ग टर्म के यूज़ के लिए है। ओके, सो लेट्स स्टार्ट द सेशन. So some important points that are concerned with labor. The first one is gravida. Gravida simply means a pregnant woman, and para. Para means to bear. Okay, it has some conditions. So let's see what does para means. A woman who has been produced a viable infant. Viable stands for a baby who weighs either more than 500 grams or the baby is more than 20 weeks of gestation, regardless of whether the infant is alive or dead at birth. सिंपली अगर आप पैरा का मतलब समझना चाहते हो तो ये पैरा का मतलब होता है कि अगर कोई वुमन ने एक बच्चे को जन्म दिया, ठीक है, पर वो बेबी जो है वो डी कर गया है और चलो मान लो वो अलाइव है, पर क्या कंडीशन होना चाहिए कि वो बेबी जो है वो पैरा में काउंट होगा। तो उस द बेबी शुड बी मोर देन 500 grams ऑफ वेट और द बेबी शुड बी ऑफ मोर देन 20 weeks of gestation. Okay, so if the baby has at least one condition, then it will be counted in the para. Okay, the next condition is what if a mother has given twin birth, so then also the para will be 1. Okay, let's suppose a mother who has been pregnant for 4 times and she has twins. She has given birth to twins 1 time. So here G score will be what? 3, है ना, and para will also be 3, not 4. Okay, so if a mother is giving birth to a twin, it will be considered 1 birth. Okay, now let's see primi gravida. What does it mean? Primi gravida means a woman during her first pregnancy. Primi means first and gravida means pregnant, as we already saw, है ना। देखो gravida का मतलब है pregnant woman, है ना, and primi gravida, तो a woman during her first pregnancy. So the next term is elderly primi gravida. तो primi gravida मतलब first time pregnancy, and then elderly a woman who ages more than of 35 years of age and conceive for the first time will be called as elderly primi gravida. Now let's move to the next point, that is primi gravida. Primi para. What does the para means? If the baby is weighing more than 500 grams of weight or more than 20 weeks of gestation. Okay, so a woman who has delivered one infant of 500 grams or of 20 weeks gestation, regardless of its viability means whether the baby is dead or alive. Okay, multipara. A woman who has carried more than 1 times a fetus to viability, regardless of whether the offspring were born alive or dead. जैसे कि मैंने पहला एग्जाम्पल में बताया था कि, है ना, अगर मान लो a woman is pregnant, okay, for 4 times in which her 3 children are alive and the last baby who was born in 18 weeks of gestation. Okay, so here what will happen? The G score will be 4 but the para score will be what? Only 3. Why? Because the last baby was born before 20 weeks of gestation. So simply आपको यही समझना है, multi para का मतलब कब होगा? जब a woman has carried more than 1 time of fetus to viability. जैसे I said G4 and P3 मतलब more than 1 time. Okay, इसीलिए this word is written here that a woman who has carried more than one time a fetus to viability regardless of whether the offspring were born alive or dead. अगर मान लो वही लेडी जो है जिसका मैंने बोला कि G4 है P3 है, ठीक है, तो G4 है और P3 है, मैंने इसलिए ऐसा कहा क्योंकि जो लास्ट वाला बेबी था वॉज बॉर्न बिफोर 20 वीक्स ऑफ गेस्टेशन, दैट इज 18 वीक्स. अगर मान लो इसमें से कोई एक बेबी, जैसे थर्ड वाला बेबी जो है वो डी कर जाता है, ओके, एट 1 ईयर ऑफ एज, तब आप क्या लिखोगे? तब भी आप G4 ही लिखोगे और P3 ही लिखोगे. क्यों? क्योंकि मोर देन 20 वीक्स ऑफ गेस्टेशन वो पहला तीन बेबी वो क्रॉस कर चुके हैं, इसलिए, ठीक है. Now let's move to the next term, that is grand multipara, a woman who has given birth 7 or more times. Okay, so simply grand matlab more than 7 or 7 or more than 7 times of birth. Okay, nullipara means a woman who has never produced a viable offspring. Okay, now delivery. What does delivery means? Giving birth to child together with placenta and membrane by parturient concerning childbirth woman. Simply delivery क्या होता है कि when a mother delivers a baby, है ना, along with placenta and the membrane. We all know that when a baby get delivered, that along with the baby a membrane also comes and the placenta also comes. Okay, that is known as delivery. Now the next term is preterm labor. What does preterm labor? Expulsion of fetus through labor before 37 weeks of pregnancy. Don't get confused. There is one more term, preterm labor and premature labor. Okay, so preterm labor simply means that expulsion of fetus through labor before 37 weeks of pregnancy. In what condition we will say that the pregnancy is a preterm labor? When if the mother comes in 36 week of pregnancy, okay, then it will be called as preterm labor. Now missed labor, labor in which true pain begins but subside. Okay, there are difference between true labor pain and false labor pain. I hope you guys know, and if you guys don't know, you can DM in the comment section. I will teach you. Okay, now this may be a sign of dead fetus or extrauterine pregnancy. So it simply says when a missed labor can occur. Okay, so when the fetus is dead, or the extrauterine pregnancy means if the pregnancy is occurring in the fallopian tube, in the ovaries, in the lower segment of the uterus. Okay, so in that condition missed labor can occur. Now the next point is precipitate labor. Okay, what does precipitate labor means? Labor marked by sudden onset, okay, rapid cervical effacement and dilatation and delivery within 3 hours of onset of the labor. Simply, if a labor pain is occurring within within a shorter period of time, that is 3 hours, less than 3 hours, it means that कि अगर जो लेबर है वो आपका विदिन 3 आवर्स में ऑनसेट होता है लेबर पेन, और 3 आवर्स के दौरान ही वो तुरंत बेबी को डिलीवर कर देते हैं, उस कंडीशन को वी विल से प्रेसिपिटेट लेबर. ओके, why it is happening? Because sudden onset is there, rapid cervical effacement, it means softening of the cervix is occurring, and the dilatation is also very fast. That's why the baby get delivered in within 3 hours of onset of the labor. Okay, so it will be known as precipitate labor. Now the next point is encourage client to pant between contraction. So these are the management, I think. So the one important time is that as it is a precipitate labor and the normal duration is not occurring, so what can happen? we all can guess that there is a chance of soft tissue trauma of the maternal genitalia, okay, and fetal hypoxia, intracranial hemorrhage due to sudden compression and decompression of the fetal head, okay. So these are the problems that are associated with the precipitate labor. Now one maneuver is there, that is Ritgen maneuver. So what does it does? A manual method of controlling the delivery of the fetal head in precipitate labor, okay. So this maneuver is used in precipitate labor by applying a gentle pressure to the fetal head towards vagina to prevent damage to the fetal head and vaginal laceration. Also support the perineal area. Deliver the infant between contraction. So simply Ritgen's maneuver is used for what purpose? So for the purpose of managing the precipitate labor. And here what is the function of this maneuver? It simply does what? Controlling the delivery of the fetal head, okay, by applying gentle pressure to the fetal head upward and upward the vagina to prevent damage to the fetal head and vaginal laceration. So what happens in precipitate labor? Already mentioned that there is a rapid cervical effacement and dilatation and delivery within 3 hours of onset. So what happens? The normal duration is not occurring, so everything is getting so fast, okay. So to prevent the problems associated with precipitate labor, what the healthcare professional have to do? So he have to apply a gentle pressure to the fetal head upward or towards the vagina to prevent the damage to the fetal head as well as the vaginal laceration. It is for both mother and child safety, okay, and it also supports the perineal area, okay. Now the last point is prolonged labor. If the labor is lasting for more than 20 hours and the normal duration is what? 18 hours, okay. So if it lasting more than 20 hours, then it will be called as prolonged labor. Now mini labor. What does mini labor means? Expulsions of pre-viable fetus through normal process of labor in a miniature form called mini labor, okay. It is self-explanatory line, so I don't think that it needs any explanation. Now let's move to the most useful thing that can be used in the clinical area, that is GTPAL score, okay. What does G means? G means gravida, okay, gravidity, the number of pregnancies including present. Simply means like a mother is has given 3 birth already, and now she is in labor pain and she has delivered. Now the earlier the GTPL G score will be 3, but now it will be G4, okay. Now the T stands for term birth. Term birth means more than 37 weeks or 37 weeks, okay. If the the number of birth the mother has given, that were term, it means those birth which has completed total 37 weeks of gestation, okay. Now P stands for preterm birth. Don't get confused with parity, okay. When I was in BSc, I always used to get confused with P, that it stands for parity, but it is not parity, it is preterm, okay. Number of births before 37 weeks of gestation. A means abortion. Number of miscarriages occurred before 20 weeks of gestation. As we already know that if the baby crosses 20 weeks of gestation, it will be counted in para. So if the pregnancy is less than 20 weeks, then only it will be counted in abortion, okay. And L means live children. How many children of the woman is still alive, okay. And here is a condition that twins consider 2 living children, okay. जैसे I said na that if a mother delivers twins, then the P will be 1 and the G will also be 1, but in live birth it will be considered 2, okay. sometimes questions come in the competition, like what is the GTPL score of the following statement. Okay, so this was for today only, guys. Kindly give me the review that how much you understood the topic, and if you do not understood, comment down in the comment section, and I will try my best to make more efforts to make you understand. Okay, so I will start the next class of labor in the next video, guys. Till then, follow, like, share, subscribe to my YouTube channel, and show your love. Stay happy and healthy, my dear students. Bye bye.